Good news for expectant moms in Michigan this Mother's Day. A new provision allows extended Medicaid coverage for women after their babies are born. The Centers for Medicare and Medicaid Services approved the state's request to expand postpartum benefits. The Medicaid provision allowed eligible mothers to receive only 60 days of coverage initially. That coverage has now been extended to 12 months. According to the CDC, postpartum depression can occur up to a year after birth. 1 in 8 women report symptoms of depression after giving birth. Yet the same number of women were not asked about depression during their postpartum visits. Joining us now is Elizabeth Hertel. Elizabeth is the director of the Michigan Department of Health and Human Services. Elizabeth, thank you so much for being here, and happy Mother's Day to you.
Good afternoon. Thanks for having me.
Let's just start with, I'm curious, how challenging was it to extend these postpartum benefits?
We have been advocating for a number of years to be able to extend the benefits for new moms from 60 days to 12 months, knowing how important it is to have that follow-up support for those mothers. It's been really great that over the last couple years especially, I think a lot of people have recognized that, and then to have Governor Whitmer make it a priority of hers for the state and have the federal government follow suit was really exciting. So we're really excited to be able to have this benefit now for moms in the state of Michigan.
Elizabeth, I'm sure your goal is to have other states follow suit. Do you think that will happen now?
I absolutely do think that will happen now, yes. And especially with recognizing how quickly we were able to have our plan approved from CMS. And again, the focus from the federal government on this, I think we'll see a lot of this coverage extended across the nation.
Experts have criticized the state of postpartum care for women in the U.S. for decades. Why does America lag behind so many countries in this area?
That's a really good question, and I'm not sure the answer to that. I think, we've spent a lot of time focusing on the time up to when a woman gives birth and making sure that that prenatal care is sufficient. And that's been very effective in a number of ways, although we still see some disparities in new moms and health outcomes with the baby. But I don't think we've put enough focus on how we're taking care of mom after she gives birth and ensuring, especially from a mental health perspective, that she is prepared and able to care for not only the infant, but herself as well.
That mental health component is so important. Initially, women only receive 60 days worth of coverage, but studies show depression can occur up to 1 year after a woman gives birth. What are the long-term effects of undiagnosed postpartum depression?
Absolutely. It can end in, we've seen some very tragic endings to postpartum depression that's gone undiagnosed and untreated. But in reality, it really takes away from that important time for mom and her infant to bond and to spend time together. Because, mom is experiencing these postpartum depression symptoms where she may not care and be enjoying the activities that somebody should be enjoying. So we really want to be able to provide the best possible experience for all of our moms, especially our new moms in the state of Michigan, and ensuring that they have that support for both their physical and mental health is a really important piece of that.
Absolutely. Michigan's maternal mortality surveillance also found persistent racial disparities among pregnancy-related deaths in your state. Will this Medicaid expansion address those issues?
It is absolutely part of our plan to continue to bring the disparities in align with other numbers in the state of Michigan and ensuring that women have access to a physician for at least 12 months after they're giving birth absolutely will help align those outcomes. It is so important to make sure that we are providing appropriate care for new moms and catching not only, again, the mental health effects sometimes of giving birth, but making sure that the physical health is addressed as well as long-term family planning.
Yeah, well, congratulations on extending these benefits. Such important work. Elizabeth Hertel, thank you so much.
Thank you. We're so excited.